Come right in here for me. Have a seat. We're going to do an assessment today. First thing I'm going to do is provide us with some privacy and give us proper lighting. I've gathered all my equipment here. I'm going to wash my hands. My name's Mariah. I'm a nurse. We're going to do an assessment on you. Can you tell me your name?
Austin.
Austin, it's nice to meet you. Do you know where you are right now?
Clinic. Do
you know what day it is?
Thursday.
Do you know who the president is?
Obama.
In speaking with Austin, I can tell that he's awake, alert, and oriented. Times 3, his speech is clear. He can hear me well. His general appearance is well maintained, good hygiene. His nutritional status is healthy. He is appropriate for the situation. His clothing is appropriate for the weather. I'm going to go ahead and inspect his skin and his hands. He's pink, warm, and dry. Both of his hands are clean. Again, good hygiene noted. I'm inspecting his nail beds. They're pink. Cap refills less than 3. We're going to continue on with the assessment. First thing I'm going to do is inspect your scalp. Alright, I'm looking for any lesions. It is symmetrical. I'm looking for any pain or masses with palpation. I'm also going to go ahead and check his hair to make sure it's not coarse or brittle. We're going to move right on to your sinuses. Maybe look up. I'm going to check his frontal and maxillary sinuses. Looking for pain, palpation, deformity, no abnormalities noted. Then check his temporal pulse, temporal mandibular joint. Go ahead and open and close. Range of motion is intact. Alright, I'm going to inspect his eyes. First I'm going to start with just the external structures. His sclera is white. Conjunctiva is pink. Pupils are round and equal. Looks like they're about a size 2. We're going to do some visual acuity tests. I'm going to have you cover your right eye. Okay, and then go ahead and remove that and cover your left eye. Vision clear and equal in both? Okay. We're going to do some testing on your peripheral vision. I'm going to need you to tell me whenever my fingers come into your view.
Now.
Good?
Now.
Good?
Now.
Alright, now we're going to do the 6 position and cardinal positions of gaze. Take a look at my finger and I need you to follow it with your eyes only. Good. Alright. I'm going to take a look at your eyes a little bit closer for me. You just keep looking right here. His pupils react to light. They do accommodate. They're equal bilaterally. Alright. Now I'm going to move on to your nose. It is symmetrical. There's no drainage noted. I'm going to take a look inside. Membranes are pink and moist. Septum is no abnormalities noted. I'm going to do a patency test. I'm going to have you plug one side, blow out and in. Another side. Good. Both sides are painted. Now we're going to move on to your mouth. Can you just open up for me? Alright, I'm looking inside. His mucous membranes, a little bit wider for me. Mucous membranes are white. Put your tongue away again just a second. Alright, hard and soft palates are intact. Teeth are intact. There's no redness, white patches. Stick your tongue back out for me. I can visualize the uvula. Say ah. Move your tongue both sides. Good. Alright. Now we're going to look into your ear. First we're going to do a hearing test. I'm going to plug one side of your ear. I'm going to say a word and you whisper a word and you tell me if you know what it is, okay?
Lightning. Thunder.
Good. Now I'm going to look inside your ears. You're looking in the canal and the tympanic membrane. Alright, no redness noted, no drainage. Tympanic membrane is intact, no bulging. And that is equal bilaterally. Alright, we're going to move on to your neck. So first thing I'm going to have you do is go ahead and look down for me. Look up. Look down to the left and the right. Range of motion is intact. Push against my hand. And other side. Good muscle tone is noted. I'm going to inspect his throat. I'm going to go ahead and palpate his lymph nodes. I'm looking for any kind of swelling or tenderness along in there. Alright, I'm going to check his carotid pulse. Present and strong, both sides. I'm going to palpate his trachea. It's midline. There are no masses. His thyroid swelling, or abnormalities. All right, we're going to move on to your chest. It is symmetrical. There's no masses noted. There's no pain with palpation. And we're going to listen to your breath sounds next, okay? Every time I touch you with my belt, you can just take a big deep breath in and out. Good. Now I'm going to check the vibration. I'm going to have you say 99 every time I check your chest, every time I touch you.
99, 99, 99, 99, 99, 99.
And I do feel vibration, and I would note that if I was over a rib or another bone like the scapula, that it would be a dull sensation. So breath sounds are clear and equal bilaterally. We're going to listen to the back side again and have you lean forward just a little bit for me. Every time I give you a touch, we just take a big deep breath in and out. Good. Again, breath sounds are clear and equal bilaterally. I'm going to do a couple different tests that Ed would be concerned if you had any consolidation about. The first one is going to be the whisper test. What I'm going to have you do is I'm going to have you whisper 1, 2, 3 every time I touch you with the bell.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, and I was not able to hear him say 1, 2, 3. I just visualized it as he mouthed the words. The next test we're going to do is I'm going to have you say the word 99 for me every time I touch you with a bell.
99, 99, 99, 99, 99, 99.
Okay, and it was very muffled. Now this time I'm going to have you say the word E every time.
E, 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 E.
Okay, again, very muffled. Now if you don't mind staying up, I'm going to do a little bit of percussion. Just sit forward for me. There we go. I'm going to do a little bit of percussion. All right. Now I'm going to place my hands right here. Have you take a big deep breath in. All right. Symmetrical expansion of the lungs bilaterally. And all this breath sounds were normal. There were no abnormalities. All right. So now what we're going to do is I'm going to listen to your heart tones. I would start off by listening to this aortic valve, then pulmonic, then I'm going to do tricuspid and mitral valve, and then I'm going to do an apical pulse for 1 minute. Just breathe normally for me. Okay. His heart tones are clear. I can definitely hear S1 and S2, no murmurs noted. His apical heart rate was 74. A couple things that I also wanted to go over was I would do a Snelling test when I did his eye acuity. I would stand 20 feet away from him. I would have him cover his left eye with the smallest line that he could. And then I would have him do the same with the right eye, covering it and reading the smallest line that he could. And then again with both eyes, and I would notice it was corrected or uncorrected. And also when inspecting his mouth, his tonsil level grade was 1, which is normal. Alright, I think that concludes our assessment today. Thank you.